The cholera outbreak in the internal displaced persons camps in Nigeria seems to convey a massive public health threat to the country. Evidence on the current epidemiology of cholera required for design and implementation of appropriate interventions towards attaining the global roadmap strategic goals for cholera elimination, however, seems lacking. Scores of cases of cholera have been reported in Kuchingoro IDP camp on the outskirts of Abuja, Nigeria's capital, with 9 deaths within 1 week. Joining us now to look at the cause of the cholera outbreak, urgent measures to take to prevent future occurrence, and the fundamental plight of IDP camps in Nigeria is Uri Ngozichukwuka, author and convener of Empathy-Driven Women International Initiative. Good to have you, and good to see you again.
Yeah, hi, good to see you again.
Thank you very much for joining us.
Yeah, thank you so much. Yeah.
Yes. Well, having known you and some of what you've been up to, I know you're someone who is driven by empathy, really. So I want to take it from what we were discussing off air.
Okay.
How did you come to be involved in this particular plight, and what was it that drew you to feel you could make a difference?
Okay, I went to work in Abuja, and I asked someone, I said, I've been hearing of IDP camps, can I please visit one? And that was in February, and this is August.
Yeah.
I just couldn't go, I couldn't leave. So I've been there, not living in the camp, but I've been going to the camp like every other day, and it's been one thing or the other. I've been able to work with a lot of partners.
Which camp? Which IDP camp?
This particular one.
Yes.
Of course,
On the
I've visited.
outskirts of Abuja.
Yes, but I have visited other camps.
Okay.
But I can say that there are some camps that are a little bit more organized, but then the problems are the same all over. Now, in this particular camp, there is no hospital whatsoever, and what you have is just a shop that has one retired matron that comes in once every week.
How many people are we looking at?
We're looking at 1,750 people in one camp, and of course, we're also looking at 200, between 2016 and today, you've had 255 births. Yep. And then we're looking at, like 400 children and women and men. And not only that, you are looking at open defecation.
Okay.
So
no running water, obviously.
There's just one borehole that works and 6 tanks to serve 1,750 people. And then when I say open defecation, it is open defecation. So you can imagine 1,700 people defecating openly.
Every day.
Every day. So cholera outbreak, was even far in coming. Because, when we went in there, it was like, everybody's just going to die here.
Because I'm also reading reports here that says that there is an outbreak and confirmed that 146 people are dead from this particular cholera we're speaking about.
Yes.
In Kebbi State.
Yeah.
A further 2,028 persons are infected.
Yes. And, there were so many, we had over like 30 infections. But what we're able to do immediately was to do the ORT. We took some people to the hospital, but then we lost 9 people in 2 days, not in a week, in 2 days.
Wow.
We lost 9
people. And this is with
people.
you trying to intervene to save lives?
Yes. So.
What had they been doing before you came on the scene?
What we've been having, I would call it, have been topical interventions, not integrated interventions, where people just come and say, okay, let's do this, and then they take pictures, they look good before the camera, and we've gone to the IDP camp and all that. We've given them food, we've given them this, but there is really that we don't have integrated or integrative, intervention, because what I am here to talk about is they need at least 2 more boreholes, and then we need like 10,000, like a 10,000 capacity tank and 50,000 capacity tanks. We need to improve the hygiene. They don't have water. And then, not just, like even with a borehole, we still have to talk about pumping the borehole. Who funds the pumping of the borehole? How do they pump the borehole? So there's a solar. So during the day, the water can be pumped. But then the water that's pumped in the 6 tanks don't go very far.
True.
And so
1,000 people.
Yes, come on, it doesn't go very far. So what the urgent intervention right now would be 2 boreholes, 2 new boreholes with like a 50,000 capacity tanks, to let's just get water out there first. You know, that's the best. Because even when we intervened with the ORT and then we bought lots of sugar and salt to do the mixing, we also had to buy cartons and cartons of water, you know, so that because of course they can't drink that water.
All right.
Yeah.
So what can be done to ensure that they minimize this particular outbreak for those living in the IDPs? What are the sensitization messages you send to these people?
Okay, for you mean for them?
For them.
Oh yeah. Oh, I wish I could play a video. But what we have done is, you know, we have to teach them personal hygiene. Yeah, we have to
Going back to the basics.
Yes, personal hygiene, going back to the basics, and you know, let me just deviate a bit. Now, we for us to teach the women, you know, skills. One of the things that we did, because we knew that it was not going to be easy working with those women, and so we had to provide the women, we took like a week, you know, to provide the women with bathing soap, you know, deodorant and everything, because we're going to be working with them, you know. So, and they were really excited and they were happy because no one had actually, like, you know, come to teach us skills, you know, and take, you know, our hygiene into consideration. So personal hygiene was very key. And for them, it was like a learning process. It was like, okay, we can actually be cleaner, you know, than we are. And then, of course, they had the soap, they had deodorants, they had sprays and everything, and they were excited about it. So we've been doing a lot of personal hygiene. And honestly, I want to say this again on air, there's a lot of infection and STDs.
Sexually transmitted diseases.
Oh, absolutely. And if you have 255 children born between 2016 and now, certainly lots of activities have been going on.
True.
And so we were actually working on having the very first reproductive health medical outreach, working with doctors, you know, that's also in the pipeline.
It feels like we're just scratching the surface. You probably need to come back because integrative intervention, there's so much we need to talk about. We're even just talking water, we're not talking food and other things.
No.
But thank you so much for your time. We're out of time on this particular meeting, but we look forward to seeing you again.